everyone. My group consists of Steffi Resendez, Cassie Salvo, Emily Hine, Melissa Carabrese, and myself, Justin Ford. And our PICO question is, in patients with breast cancer-related lymphedema, is yoga with conventional PT more effective than conventional PT alone as it relates to arm growth and VAS? So our PICO question really focuses on lymphedema in breast cancer patients and tries to find out if they can become more functional with the use of yoga and implement it in their plan of care. So we wanted to start off our presentation with an open conversation between us and the class. Maybe a relative or maybe even themselves have had experience with breast cancer-related lymphedema, and that way they could even give us some helpful hints. But this is really just to get an idea of how much experience the class has when dealing with our topic in particular. Now we'd like to get started on some of the research on the effects of yoga on lymphedema. Our first article is Narhi et al. In 2016, they tested a newly developed yoga protocol against previously outlined protocols and found a decrease from 2.4 to 1.2 liters in 8 patients with grade 3 lymphedema after 3 months of treatment. So this study was able to provide significant results as edema was reduced by 50%. There were 20 yoga exercises and 5 deep breathing exercises implemented. The author focused on slow, controlled movements of the upper extremity. The study concluded that the exercise regimen had to be performed at standardized treatment facilities due to the small size of the study, but it had very promising results. There was, again, the next article is Lee et al., 2015, and then the yoga was performed in 60-minute sections 3 times a week for 12 weeks, and it did not induce lymphedema. In past, people felt they needed to wear compression sleeves due to the upper extremity resistance activities, but this study suggests that otherwise. Although there was no significant effects on arm growth and the affected limbs, there was no adverse effects on the patient's lymphedema as well, so that's a pretty positive outcome from this study. And the last study on this slide is Galanto in 2012. They found significant improvements in balance and flexibility on postmenopausal women with breast cancer who are breast cancer survivors. The one thing that was pretty good about this article is they utilized standardized measures that we've seen a lot in the past. They used the sit and reach test, and as well as the functional reach. The pain severity decreased significantly in the study. You can see by our first bullet point there. And most importantly, there was no adverse effects nor developmental or worsening of lymphedema was noted. So these studies really show that lymphedema is safe to be implemented on top of the standard plan of care and has some high ceiling going forward in the future.
Aside from yoga's impact on lymphedema that Justin mentioned, the literature explored various other effects of yoga on patients with lymphedema. A meta-analysis by Greenlee et al. Determined grade A level support for yoga and relaxation imagery for combating anxiety and mood disorders in patients with breast cancer. Additionally, 2 other studies were selected and found to increase vitality, decrease fatigue, increase well-being, increase body awareness, and increase patients' reported social functioning. 3 other studies we looked at found additional benefits from yoga on patients with cancer-related lymphedema when used in coordination with other complementary medicines. A study by Finney et al. Found that patients felt the complementary medicine, which included yoga, was highly effective, judged on the perceived effectiveness rating scale. Thomas et al. Also found that yoga had a positive impact on fatigue, posture, and self-understanding of arm morbidity. And finally, London et al. Found that yoga helped to improve both posture, pelvic position, and shoulder strength. So what do these studies really tell us? After reviewing the literature in respect to our PICO question, we feel there is still a need for continued research, particularly on the direct effects of yoga on arm girth and pain. Some takeaways from the current literature include that while yoga may not directly decrease arm girth or volume, it appears it does not increase upper extremity volume, which is a big deal for patients living with lymphedema who wish to continue exercise for various other benefits. The literature points out that these benefits may include improving psychosocial aspects of a patient's life, the perceived quality of life, upper extremity strength, and flexibility.
So now we'll introduce you to our patient Amanda. She's a 30-year-old female. She has a past medical history of breast cancer and right mastectomy 2 months ago with secondary right upper extremity lymphedema post-surgery. She presents to our outpatient clinic with pain in her right arm, which she rates as 3 out of 10, with recent onset of increased swelling. Her current goals are to decrease the swelling for her arm to look normal again and to decrease her pain to be able to perform her work and social hobbies. Her body structure and function impairments include limited mobility and strength throughout her right upper extremity, pain and pitting edema, which is labeled as a grade 1 with a 25% increase in limb volume compared to the uninvolved side, which places her in the moderate edema category. Some activity limitations include difficulty performing self-care like bathing and dressing, as she has difficulty reaching overhead and behind her back, as well as household ADL such as cooking and cleaning, again due to limited mobility, strength, and pain. Participation restrictions include difficulty playing tennis with her team and difficulty driving to work due to pain. When it comes to environmental factors, she has a strong support system and is currently using a compression sleeve and has been able to do some reorganizing with the help of her family and friends both at home and work for easier access to items she uses regularly. Unfortunately, she has decreased self-esteem due to swelling. However, the swelling is recent and she is hopeful it can be managed relatively quickly.
So what can we as physical therapists do? So we can provide many interventions for this patient population. So on this slide, it has the complete decongestive therapy program, which is a 2-tiered program that incorporates a combination of manual lymph drainage, bandaging and/or compression, exercise, and self-care. If not using the complete decongestive therapy approach, we can still provide those individual interventions listed on this slide. So manual lymph drainage, we can improve circulation and redirect flow. Compression, we would use short stretch bandaging like Comprelin versus long stretch, maximizing working pressure and minimizing that resting pressure. Kinesiotaping can be incorporated to stimulate lymph and blood circulation when skin is essentially lifted as the body moves, and general exercise can influence protein absorption and increases vessel activity along with other benefits. We can also educate on proper diet and provide a good home exercise program. So with our research, it pretty much shows us that adding yoga exercises in addition to all of these interventions into a patient's plan of care can help decrease or maintain volume in the affected limb, help improve balance and flexibility, pain levels, and overall well-being and mood. Alright, so as a class, we are all going to learn and go through some yoga poses together that we gathered from a study that looked at yoga and breathing exercises as a self-care intervention for lymphedema. This is the first pose called Tata Asana, or the mountain pose. So I'll kind of explain this pose first before the class goes ahead and performs it. So everyone will then go ahead and stand with their feet together. You will then inhale as you raise your arms up overhead and raise your heels simultaneously off the floor. You're going to take another deep breath in, then release it out, and then one more, and as you exhale, release everything down. And then if someone needs assistance, if you're incorporating this into someone's plan of care, they may use their unaffected arm to assist their other arm up overhead, or they can also stand with their back against the wall for stability for balance.
So the next pose, we are going to start by sitting on the floor. You cross one leg over the other so that that knee is stacked right on top of the other. We're raising up our affected arm to the mid-back, dropping that contralateral hand back to meet it, and we're taking deep diaphragmatic breaths as we go. You're going to release, breathing that arm straight up, then relax while inhaling. To make adaptations for this, you can use a towel if you cannot reach your hands behind the back, or you could also use your unaffected arm to help lift your affected arm. For the next pose, we are going to start by standing with our feet together, abducting our arms while inhaling to place them on our shoulders. Bring those elbows forward now and rotate your shoulders back, making big circles. Exhale with flexion and inhale with extension. Some adaptations for this one are you can have a caretaker help you with it,
We can perform it in supine, or we can perform it unilateral using an assist from the unaffected upper extremity. For anyone further interested, some of these following charts are those from the yoga-based protocol, which we got these poses from. They were all designed with the idea to be similar to manual lymph drainage for self-treatment. They were designed to target muscles surrounding specific lymph nodes, stretching the skin, and utilizing some deep breathing techniques to really try and stimulate that thoracic duct. In general, they kind of go off of a trend of flexion with exhalation and extension with inhalation.